Hey, everyone. Welcome. As always, today is really about you. We're going to take your calls. Got a few comments I want to make before we get started. I was on a very interesting Twitter Spaces day before yesterday. And during that conversation, I had some realizations that I want to share with you and sort of map out. And then we will go to your calls. As always, I am watching the Rumble rants and also over on Restream, all the chatting going on there. I try to watch what you guys are doing. I try to respond to what's there. I promise you I won't get all of it, but I do the best I can. I'm thinking about a couple other things while I'm up here. Susan is not with us today. She just had some oral surgery, so please wish her well. She's doing great, but I don't want her particularly out of bed, though wouldn't be surprised if she dropped in on us, at least on the Rumble side. So, all right, let's get right to it.
Our laws, as it pertains to substances, are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying. You go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say.
And as usual, we're out on Twitter Spaces, and if you want to come up and ask questions, just raise your hand, and please be patient. I'll try to get to everybody I possibly can. See, we got a pretty good space going right now, so do be patient. The Spaces I was on the other day was really about one of the Twitter files, one of the Twitter dumps, about, in this case, showing Pfizer's duplicitous action with the government in order to suppress dissent and raise voices that help them financially. It was astonishing, disgusting, but every time Twitter pours out more information, it gets more and more bizarre and more draconian. So I don't want so much to talk about that, though I'm willing to entertain questions on it. I'm more interested in talking about what occurred to me in the course of the conversation about those things. Let me say people are also interested in perhaps my opinion about the signal that there are perhaps strokes in the Pfizer vaccine over the age of 65 or extra stroke. I've not seen that. I've vaccinated many hundreds of people in that age group. If anything, maybe I've seen a little more atrial fibrillation, but I'm not sure about that even. My persistent impression is, and it's possible to have this nuanced approach, everybody. You can feel that a vaccine is worth the risk in certain age groups and not worth the risk in other age groups. So I will tell you that I believe it is still worth the risk, 65 and plus. I might be wrong, and that's certainly possible. But my patients that are vaccinated and boosted have had less trouble with COVID than those who were not. I use a fair bit of Paxlovid, though I've seen lots of rebound. And I have moderate concern in the 65 to 75-year-old age group, but older than that, I'm convinced we're really doing something good. And I think we have done something good. And I think the fact that we developed a vaccine with such extraordinary speed to save the lives of these populations ought to one day be thought of as something good. The problem is that we have gone way over our skis in terms of where else we're recommending it, and these mandates and this pushing. That's where I have a problem. That's where I'm objecting. Mostly because I can't even give my patients informed consent. I don't really know yet, are these signals I think I'm seeing real? And certainly I've watched NFL football my entire life. I've never seen somebody drop dead on the field. That's never happened. And you can make an argument all you want about it being commotio cordis. Perhaps it was. But let me just give you a few facts on commotio. Commotio happens almost exclusively in pre-adolescent males with a thin chest wall because of a strike by an object like a puck, a baseball, or an elbow, a projectile. It almost never happens in football. And if you've ever seen commotio, they go flaccid immediately. Now, this particular DeMar did not go flaccid. He stood up and took a couple of steps. And people are surmising a very rare event and then are twisting themselves into pretzels to explain why that happened, to make it an even more extraordinary rare event that maybe the Q on T was hit and caused a ventricular tachycardia that degenerated into ventricular fibrillation. No, That didn't happen. And I find it odd that we're not finding out what happened to him. I'm worried that it's a pulmonary embolus or some sort of clotting phenomenon such as that. And then I'm wondering what is causing it. Is it COVID? Is it the vaccine? Is it the vaccine plus COVID? That question needs to be answered, and it's not even being asked. That's where I am deeply, deeply upset. That's where I'm concerned. So for my 30-year-old males that I'm advising about vaccine, yes or no, booster, yes or no, I can't give them informed consent because no one has given me the information that I need in order to do so. So in this state, if I even bring up these concerns because of AB 2098, I could possibly lose my license. So this is a freaking mess. Now, what I want you to know is that, and this is what I want to get at today, is that this is all terribly, terribly familiar to me. I lived through the opioid crisis. And my experience in that opioid pandemic was so precisely the same as what I'm experiencing now that I am postulating, more than guessing, I am hypothesizing that there is a similar phenomenon afoot. So I want to take you through the opioid crisis and see if you can see correlates with today. So opiates were excessively prescribed back in the 1890s when they were first developed, and we had the first wave opioid pandemic. The Harrison Narcotic Act was essentially what put that to rest. 20,000 physicians were criminally assailed, and allegedly tens of thousands put in jail. I don't have confirmation of that, but I know that tens of thousands got into criminal trouble because of overprescribing of opiates. That was the mid-1910s. So from 1915 on, doctors were afraid to prescribe opiates. We freeze when doctors get in trouble. This lasted 50 years. We were afraid of opiate addiction. We were afraid of overprescribing. 50 years. Then in the 60s, a movement came in that really caught wind in the 70s to better treat cancer pain, which was, of course, the right thing to do, to treat cancer pain with readily available opiates and to expand our opiate and opioid base to treat people who were dying. And so they had dignity and and didn't have misery at the end. It was a very important movement, but some evangelists emerged from that movement. I'm going to point out the correlates with you as I go through this. Now, I'm saying that the vaccine was a very important thing. We got an extraordinary thing that in a few months, we got something that helped a certain population, to my estimation. Might be wrong, to my estimation. But evangelists emerged. People who decided the vaccine must be given to everybody, no questions asked, and then must be mandated. Somebody was behind that. Back in the opiate crisis, there was a doctor, she was actually a nurse, if I remember right, and a pain specialist and his fellow that went out and said, we are the saviors of the American public, and we are going to save America from ever experiencing any pain. And they got hold of their professional societies, the pain societies, who then got hold of the regulatory agencies. First, the Veterans Administration, who invented then the pain is the fifth vital sign. Do you remember that? Where your pulse, if it was 0, what's the pain scale? If you didn't measure the pain scale along with the pulse and the blood pressure, you would be sanctioned. Joint Commission on Hospital Accreditation followed suit. California Medical Association, the California Board of Quality Assurance, the Department of Mental Health. I was sanctioned by all of them, including my hospital, because I stood up and said, I'm not going to give opioids to my heroin addicts in withdrawal because they're a little uncomfortable. I have many other things at my disposal. They will be fine, but they're all unhappy in withdrawal. If I give my heroin addicts opiates, they're not have any chance of getting better. Now, sidebar, we didn't have Suboxone back then. It's kind of a different story, but Suboxone is a special case of opioid. So there we were with people, an evangelical movement. And guess what? The drug company, I'm blanking on the name of the drug company now. Hey, maybe you can help me, Caleb. The one that was just sanctioned for billions of dollars or destroyed by that. The ones that were major contributors over at the Met Museum in New York. They didn't cause this. They blew wind into the sails of the physicians who were already evangelically creating the movement. The drug companies don't practice medicine. They take the evangelists, they notice them, they support them financially, and they go full force with them with the lobbyists and the regulators, and they get behind them and show them where to go. And so the drug companies are duplicitous, not causational. Not saying they should be off the hook. I'm saying what we're going to find, much like in the opioid crisis, I believe when the Justice Department gets involved in figuring out where the excesses of our government were, where they went awry in terms of excess and maybe infringing upon some of our First Amendment rights, they're going to find evangelists. And if the evangelists for vaccine are anything like the ones for the opioids, they're going to say it out loud before it's going to be out there somewhere on emails and things. They're going to say it out loud, and they will harm people. And they will harm people and still push on. This was the thing about the opiate crisis. You could not get people to stop. My patients were dying all around me because of my peers overprescribing. And it wasn't, most people don't know this. It wasn't until Jeff Sessions, who was the Attorney General, first Attorney General in the Trump administration, I believe, stood up and said at a symposium and said, I see what's going on here. I know what this is. I know what to do about it. I'm going to take care of it. And in about 6 months, you'll see. And I'll be goddamn if in 6 months he hadn't taken several of the evangelists and prosecuted them criminally. And then what happens is my profession freezes. It's not, was it Purdue Pharmaceutical? Caleb's looking it up for me.
I'm not sure that. I tried looking them up.
Purdue was involved.
It might have
the
been
other one. You know
not
what?
the Sackler
Let me go back
family.
to the restream. Yes, Sackler. That's those are
Oh,
the
it's
guys.
the Sackler
Is that
family.
Purdue?
Oh yeah, a Sackler
okay.
and Purdue.
Purdue. Thank you
That's
guys
what
for
I
all
heard
saying.
from. Thanks, Alana.
I should have just gone to the restream. Thank you guys. You're very responsive there. I appreciate it. In any event, of course, in this case, it's going to be Pfizer and Moderna and BioNTech, and you watch and see that they're not standing behind a bunch of physicians who are pulling the weight for them. So, all right, where was I going with this? So Sessions went in, put some of these people in jail, and my profession froze in place. And magically and suddenly, they started reconsidering the evangelist point of view. They started looking at what really was going on. They stopped silencing and sanctioning. Sound familiar? We didn't have social media in the 90s, but they were sanctioning us. They were going after our licenses, all the same stuff. Same stuff you see. It's like line and verse, the same playbook. It's uncanny. It's weird. And I'm not saying there's somebody consciously doing the same thing. I think this is just what happens when there is zero place for religious evangelism in medicine. If you see a doctor that is evangelical about any topic, run, okay? Every doctor should approach his or her clinical impressions with humility and caution and real willingness to adjust course and think through other ideas. If they are an evangelist for some particular movement, be very, very careful, because they have a lot. Maybe they'll be right once in a while. That's certainly possible, but they have great potential to do harm. Let's see. Somebody asked me about a super chat. Is there a super chat upstream somewhere? I didn't see it, so I apologize. Caleb, maybe you can, since Susan isn't here, you can call my attention to any super chats.
Yeah, I will. I don't see a super chat there. Yeah, I'll put it up on screen.
Okay. Somebody said, all right, good. Thanks. All right. So Caleb, since you're the one I get to bounce things off with today, does that story make sense to you? Can you see the did I explain it in such a way you can see the correlates?
Absolutely. And I didn't even know about
weird,
that history there. It's very interesting for me. I guess because I wasn't very aware of what was going on throughout the opioid epidemic. So it's interesting because I was not aware of any sort of pushback or anything until the Sacklers, till that whole case went through. I didn't know any of this backstory or anything. Oh, yeah. So.
Well, and of course, the fact that the Justice Department was taking aggressive actions helped set up the series of lawsuits that followed against the drug companies who were duplicitous in all this. And we're breaking laws, by the way.
Do you think that something similar might happen sometime in the future based on what's going on now, that there's going to be a legal pushback from the government? And
I know of many cases brewing, and we have been told that the House is going to put together a judiciary committee that is going to look into this sort of under the umbrella of excesses or weaponization of the government. But I'm hoping that they really look at what exactly happened here. Who are the players? What did the emails tell us? They're going to have to really do their research very, very carefully. Now, Elon Musk has done them a remarkable favor by getting them off to a running start. They have a running start with all the Twitter files. I mean, that's going to give them direction and people to look at, and a lot of evidence already of excesses. And,
Right.
you know, the government stepping in and destroying people and affecting their First Amendment, I'm not sure to what extent they've broken any laws, but affecting First Amendment expressions for profit. Now they have the connection with for profit. And that is... Woo, I don't know. Wild in my world. I've never heard.
I almost think that even if they can extract all politics out of this and do this as a lawsuit based on false advertising in a way, if these companies were all saying 100% safe and effective for everyone, and then use that to convince politicians who aren't medical experts to say, "Oh, this is the best way," then it might. That would be to me. That seems like the way out for the politicians to say, "Well, we were lied to with false advertising, and then we pushed all these laws forward and these mandates, and they can wiggle their way out of being culpable that way." And then
I don't know. I have no opinion about it, but I do believe you're going to find some politicians and some physicians. And I don't know why Susan is on the Rumble Rants. She must be high on her pain medication, because she is stating, "I love morphine. I love morphine" over and over again on the Rumble Rant. No. So Susan, be careful.
That might be the fake one.
I told you to stay off. Oh, is there a fake First Lady of Love?
She told me before there's a fake one, but wait, actually that might possibly be her. She might have just tasted it.
Hard to tell when she's coming off surgical meds. What's her and what's a fake one? So if Susan, she said, "Oops." All right, so it's probably her. Okay, so there we are. History is always a great lesson. History doesn't exactly repeat itself, but certainly those that do not study history are doomed to repeat the failures of the past. And there is a lot to be learned from looking at the opioid crisis. It was so disturbing to me and killed so many of my patients. And still, I never forget, I did a town hall with Anderson Cooper, and there was a physician in there in the panel talking about the opiate crisis, and the things were just getting turned around at that point. And she goes, "Yeah, I mean, I was part of the problem. I would give 90 Vicodin every time somebody left the emergency room. That's how I was trained." I thought, you should be falling on your sword. You should be falling on your sword. You should be ashamed and disgusted and trying to clean up your side of the street. These are horrible mistakes that killed untoward numbers of people and has fueled the opioid crisis today. So just how it all went down with opiates. So what happened with physicians, we froze in place. We stopped prescribing. We were fearful of getting criminally assailed. And as opposed to bringing all these patients in who these doctors had made into addicts and sit them down and go, "Look, we didn't intend this. I'm now understanding this is more of a problem than I realized. You're addicted to these meds. Neither of us wanted this. We're going to have to get you some treatment." They did not do that. I never heard of any doctor doing that. Instead, what they did is say, "You're a bad patient. Get out of here. I can't treat you any longer." And where do you think somebody who's addicted to pills goes when he or she is cut off by their supply? They go to the street. And that's what created the heroin epidemic. And then fentanyl just followed it on the heels of that. So there we are. Well done, everybody. It was perpetrated by my profession with the duplicitous input of a drug company, of multiple drug companies, really. And my suspicion is we're going to find something awfully similar here in this particular crisis. It's complicated, but again, why would you silence questioning? And let's get back to what we've all learned through talking to Dr. Kelly and some of the people she has brought in here. So much of the problem we are in is a result of the rush to bring this drug to market, the vaccines, that is. And I get it. It was an emergency. I understand we took extraordinary risk. But now, can we please go back and fill in with the research that we would normally do? That's not happening. Another interesting point. I think I mentioned this on one of the streams, one of these shows the other day. that I'm worried about medical research. I think I pointed this out, but here are my concerns. If you remember the Danish mask study, it was a great study. It was an excellent, large-scale, well-powered, randomized controlled trial. Not perfect, but a good study. Lots of excitement. It was going to come out in the New England Journal. Suddenly, it's not coming. Then I hear it's going to come out in JAMA. Then it's not coming. Finally gets published in Annals of Internal Medicine. It's a negative study. It shows that masks mandates don't do anything. Similar things have been happening. I keep hearing again and again that people can't get things that aren't part of the narrative put into the mainstream journals. Here's an experience I had that I've never had in my entire career. I rely on the medical literature. Someone tweeted me an article about multisystem inflammatory disease. I feel like I mentioned this to you guys the other day. And this is that inflammatory condition that happens primarily in adolescence after COVID. It happens after a lot of viral illnesses. And in that particular study, they were saying that, well, if there's more than 3 organ involvement with the inflammation, it's bad outcomes. And this is an exceedingly common condition. I thought, oh my goodness, maybe I've missed this. Maybe this is why they're pushing the vaccine so hard in these younger age groups. Thankfully, I thought, wow, this will be great. I can then understand what we're doing with the vaccine in the older age group, still younger age group. Still doesn't answer the sort of 25 to 35 where we're seeing the myocarditis and stuff, but it does answer maybe for the adolescents and maybe young adults. So I went into the literature, and after 90 minutes of fishing around and going through reading dozens of studies in high-end journals, peer-reviewed, decent studies, I could not tell whether multi-system inflammatory condition in adolescents and young adults was exceedingly common or exceedingly rare. That's how off-base the literature is. I've never seen anything like that in my career where I literally couldn't tell what was going on by reading the literature. Something is off. Something is very wrong. That's what we call a signal, right? Much like the excess deaths, much like watching NFL your whole life and then seeing somebody drop dead and having people get arrhythmias all around me and seeing myocarditis repeatedly. That's what we call a signal. And understand this, clinical signals, what doctors observe, typically precedes research, right? Research is guided by what doctors are seeing and doing. And we are telling you that many of us are worried about a signal. People are afraid to speak up, don't get me wrong. But everywhere I go, I hear this like muttering about something is up. They're afraid to speak it out loud, but it's there. And research needs to follow it. Follow what the physicians are seeing, that there seems to be something up. And totally prepared to refute our signal, to go, you know what? It's not significant, or it's so rare, or whatever, or it's the risk reward is more on the basis is still weighs on the side of taking the vaccine versus getting COVID. I am completely prepared to look at that literature and sort of conclude that that's what I'm seeing. In the meantime, almost nobody goes after the question about what are we seeing? Why are we seeing it? What's going on? Why the clinical signal? What we see is first denying of the signal, which denial does not help me. It doesn't help. It's like, there's something going on. What is it? Help us define it, and then describe why it's happening. Could be COVID plus vaccine, could be COVID, could be vaccine. Or some of it could be both, right? Some of the sudden deaths could be to the COVID, and some of it could be the vaccine. It could be separate populations. Something is up, and it needs to be answered, and we need to be able to, A, render informed consent to our patients so we know how to answer those questions, and B, help the patients make the best choice for them. Safest choice, best choice. All right, so here's what I want to do. Somebody's saying Steve Kirsch went off on Jimmy Dore yesterday. What did Steve say? What did he say? And the MDs need to listen to, I'm reading your tweets here, your stream here, restream. Listen to and believe what the patients are reporting. Yes, I agree with you. Thank you, guys. So, hold on, I'm reading your stream here. Let me go over to the rants where I can see Susan talking about her love of morphine. Yep, there it is.
And we have a lot of people lined up for calls too.
Okay, good. It says doctors are sold out to Big Pharma. How? What do you mean sold out? It's really the insurance companies that control what we do. Big Pharma has almost nothing to do with it except the evangelists. They financially back the evangelists because they'll tell them to go out and speak, and they'll pay for their travel. They help them get the regulators to get their evangelical job done. The rest of us have no relationship with Big Pharma. So I don't know how you can think that we are captured by Big Pharma. Insurance companies, totally different story. All right, take a break. We're coming back with your calls. Genucel has so many products that Susan and I love. Their XV moisturizer locks in moisture, making dry spots a thing of the past, which is especially great with the colder weather, of course. And with the immediate effects, too, you can see these results in as little as 12 hours. Guaranteed, or your money back. Susan loves Genucel's vitamin C serum, the new deep correcting serum with lactic acid that hydrates your skin and reduces fine lines while preventing future wrinkles from forming. Don't believe me? Listen to Susan.
I am a snob when it comes to using products on my face. The dermatologist makes a ton of money from me. But when I was introduced to Genucel, I was so happy because it's so affordable and it works great. I was introduced to the Ultra Retinol Cream, which I love at night. All the eye creams are amazing. People notice my skin all the time, and I'm so excited because it's actually working.
Take advantage of this New Year's promotion by going to Genucel.com and getting 60% off now with a complimentary gift set when you subscribe to my favorite package at Genucel.com/Drew. All orders are upgraded to free shipping for the rest of the season. Use code DREW at checkout for an extra 10% off your entire order. That is Genucel.com/Drew, GENUCEL.com/DREW. My guest is Philip Patrick. He is a precious metal specialist, trains at University of Redlands. He has spent years as a wealth manager at Citigroup, and his current position is with Birch Gold Group. So gold has always been somewhat of a safe haven, particularly in times of great turmoil. Much like our present moment, I imagine.
Gold has always traditionally been a safe haven asset. Gold specifically has always been about wealth preservation, right? Gold has always held its buying power. You can look at as far back as you like in history. In biblical times, 1 ounce of gold would buy somebody 400 loaves of bread. And today it does the same thing. So it's a store of value. But I would say in times like this, as you mentioned, it's particularly important when you're dealing with things like 40-year high inflation, the air that's coming out of a stock market bubble. These times in particular tend to drive gold and silver up quite significantly. If things are different, the solution needs to be different as well. So I encourage everyone to get informed, and we have a lot of good information here to help your listeners.
Just a reminder, I am not a financial advisor, and I do not give out financial advice nor investing advice. Birch Gold has an A+ rating with the Better Business Bureau, countless 5-star reviews, and thousands of satisfied customers. Check them out now. Visit birchgold.com/Drew and secure your future with gold. Do it now. All right, we are back, and we're going straight out to the phones. I see lots of you are patiently waiting there, so let me get to it. This is Lisa. I'm trying to get some people who have not previously get a chance to speak, see what they have on their mind. Lisa, just there you are. Go right ahead.
Hi, Dr. Drew, a longtime follower of yours.
Thank you.
A quick history on myself here. I'm 64, and I had the J&J vaccine on March 23rd of January 21. I got a blood clot, a DVT in my leg on April 14th, which was a few weeks after that. So I obviously did not get any more vaccines.
Good.
I lost my brother this past November. He was 76. He was everything to me, and he wanted me to start over with the mRNA vaccines. And I'm pretty educated in this, and of course I didn't do it.
He wants you to start over.
Yes.
And you're 64. Is that what you said?
Yes.
Yeah.
And I honestly I fought with him on it. But here's the thing. He had a tooth pulled 2 days before he passed away. He was ill. He was in dialysis. But when I was speaking to him, he had massive clots coming out of that socket that I could hardly understand him. And I said to him, I said, do you want me to come up and take you to the hospital? And he's like, no, I'm going to dialysis tomorrow. I'll go to the dentist the next day. Okay. He went to dialysis. now he's on blood thinners, remember?
Right. So that's why he was having the problem. They didn't properly adjust his blood thinner, and that's not good. So, and then you could argue that, well, his blood count, or he's in dialysis, so his blood count may be low already. Then he fell further, and that can precipitate a heart attack even without vaccine. So, it's awful.
So you don't think the blood clots coming out of his mouth had anything to do with the blood clots that are related to the vaccine?
No, absolutely not. Blood clots were coming out of his mouth because he was bleeding excessively because of the Coumadin or the Pradaxa, or whatever the hell he was on, heparin, and that was causing him to bleed excessively. And then it was clotting as it came out because it was so much. It's like when people bleed a lot, the blood clots, and that's unfortunate. And for somebody on dialysis, his age, that's a very big deal. I mean, he should have gone to the emergency room just with that. Let me bring in my friend Siobhan. Sorry. Unmute yourself. Let's have at it. Hey, how are you?
How are you, my friend?
Excellent. What's happening?
Nothing much. So, really like what you said about the opioid crisis.
Did you live through that? Did you live through that like I did?
I did, and that's I was going to tell you. I had just begun practicing, 2004ish, and I used to get detailed by Purdue Pharma reps. And for whatever reason, I've always been mortified. Like the idea that you could take something that was essentially an analog of morphine, long acting, and give it, and we'd always be told stuff like, hey, you don't need to worry because it's long acting. It has low addiction potential.
They literally,
that's what they were selling it.
There was Pain Management had 2 or 3 articles that in the entire discipline was based on. It was something called the Porter and Jick letter, which essentially, it was ridiculous. It was ridiculous. It was insane. And we're doing this. I worry we are doing the same thing now. So in any event, back before, nowadays you would never bring a drug company into your office. You would never get near them. You never, that's just the way we are now. But back then they came in and would detail us. And I literally had to throw them out when they started telling me they had a non-addictive opiate. I was like, "There's no such thing. Get the F out of here. Just stop it. Don't insult me." Upjohn did that to me with Xanax in 1988. 1988.
Wow.
They insisted and said that I saw a patient have a seizure and I was a mess. It was just in the early days of Xanax. And we didn't know how to withdraw them or anything yet. And Upjohn went, "Oh, that's just her anxiety disorder that she had before our great medicine cured her." I was like, "Get out of here. Get out. Nope. Get out."
So the practice that I took over, they literally were giving, like, a bunch of people were coming into the practice only for opiate prescriptions.
That's terrible.
Over time, I slowly, I'd send them to a pain specialist, but I still remember like it was yesterday, because the other thing that many people don't realize, for a few years, and I couldn't tell you exactly how many, but the Joint Commission, used to be called JACO, had language talking about pain as the 5th vital sign.
No, listen, not language. I was the medical director of a drug unit. And I had to do the JACO review every 3 years, and the language was explicit. If you didn't have the happy face scale there every 4 hours, you would not get JACO approval. And what do you think my heroin addicts were? You think they were happy face for 3 days? They were unhappy face, and JACO would come in and said, "Why didn't you give him opiates? Why didn't you give him painkillers?" Unbelievable.
And Joint Commission later basically came out and said, "We never said that." And you can still see that archive.
BS. I lived it. At least 2 or 3 rounds of JACO were all about it.
Yeah.
So
and just to segue, I'll pitch out. I wrote an article in Human Events a few months ago. It's on my pinned tweet about the entirety of the fentanyl crisis. I highly recommend people just go and look at it. It's exactly what you said. Fentanyl is it's filling the void of these individuals that have no place to go. And there's a bunch of stuff that bunch of people are doing, but I think, this thing is going to get much, much worse before it starts getting better.
And what breaks my heart is I know how to treat this. I know exactly what to do. It's not that hard. you need a continuum of care. You can't just, put them somewhere for 3 days or 5 days or a month or just put them at a hotel. You have to have a continuum of care across 6 to 12 months. And it's not that expensive compared to what they're spending already. But it kills me. Just in the streets of LA County alone, it's 7 are dying a day. LA County. And that's just LA County. So, all right, I got lots of questions. I'm going to throw you back in, okay? Last comment?
Thank you.
Want to say one last comment? Yeah.
One last comment.
Yeah.
Have you heard the name Sapan Desai?
No, tell me.
Okay, so this is kind of I'm segueing a little bit, but in June of 2020, there came a series of very high impact factor journal articles written by a physician by the name of Sapan Desai on hydroxychloroquine and ivermectin. All of them were retracted.
Of course.
Very few people even know that this happened, and this is stuff that people don't realize. This was one article claimed that hydroxychloroquine was associated with higher cardiovascular mortality. The other was talking about how ivermectin basically was not effective. And this gentleman wrote at least 2 really important articles. And over the last year, they have gone back and looked at a bunch of articles. All of them were completely fabricated.
Yes, of course. How about that Lancet catastrophe?
Exactly.
There were many. Again, this is part of the evangelical excesses. Those people think they're saving humanity. It's really, woo. Okay, thank you, sir. Good to talk to you. Whoops, wrong thing. Amanda, I believe this is. Amanda, let's get her up here.
Hi.
Hey there.
Hi, Dr. Drew. I've never spoken with you before, but I'm honored to. So thank you for having me up.
Pleasure.
I just want to go back on what you were just talking about with the Xanax problem. I had a GP, so I'm 34 now. So 10 years, like 12 years ago, she would just ask me if I felt anxious, had sleeping issues, and she was just prescribing me the highest dose of Xanax at the time that she can get. So it was 1 milligram 4 times a day needed, as needed.
Right.
And then also Zolpidem, 10 milligrams nightly is needed.
Which is, so you had Xanax and Ambien. Got it. What's the question?
Yeah. I know she's more of an old school doctor, but she really messed up a lot of my 20s.
Yes.
I don't remember a lot of it.
I'm sure.
I made mistakes.
I know.
That I regret. Obviously, I'm not like that anymore.
Yeah.
But I just...
you want to know what you can do, or what do you want to know?
Well, I know right now my psychiatrist actually got me off of it.
Good. Well
cold
done.
turkey, but she had to use Klonopin, but now I'm off that.
Good. There are various ways to do it, but that's fine. I mean, look, you can call back to that. There we go. You can call back to that doctor, acute, and you can let them know, leave even an anonymous message. Here's what happened to me. I want you to learn from this. Or you can sue them, but a lot of time has past since that whole experience. And the reality is that it wouldn't take, it's not outside of the law to do this. Not all doctors understand what they're doing. She is, doing things that are excessive, but I bet she would find experts that could defend what she did, even though you and I know how devastating it is. And, in my world, if you're strung out on that much Xanax, I mean, remember Shelley from Celebrity Rehab with the blonde hair and the glasses? She was in and out of psychiatric hospitals for like 18 months. Turned out the whole thing was Xanax withdrawal. And she was given 5 different diagnoses across those 18 months. Some of them like devastating, like life-ruining diagnoses. In locked units, out of locked units, all Xanax withdrawal. So let's not minimize how serious that is. Let's get Christy up here. Christy, what's going on? Sorry, I've got to go quickly through over the calls here, guys. Appreciate you stepping up, though. Christy?
Hey, Dr. Drew.
Hey, what's new?
Hey, I know we got to go fast. Hope you're doing well, Susan. Aw. I just have a couple announcements really quick and then maybe a question.
Great.
Is that okay?
Fine.
All right. I got a FOIA in. Aaron's series legal team is helping me punch it through because the FDA is pushing back. So I just wanted to let people know.
Already, it sounds like a good thing if they're pushing back. I want to know what's going on.
The FDA pushed back immediately. Yeah.
Interesting. What are you looking for? Or can you say?
Yeah. Oh, yeah. Absolutely. Because it's public, and I posted it too, and I can send it to you. So, if for people to just not talk about the science, but just imagine you got your blood analyzed in every way possible, I put in a request for the proteomics and the analysis of both the RNA and the LNP, Western blots, adjuvant files, fragment analysis, things we've talked about, any heterogeneity observed between vials. I also asked for that.
And you're going to find exactly what your group found, right? I mean, could it be anything else?
In the UK and Australia that they already found, yes. And then I also asked for, so I asked for a whole year's worth of data. I'll pay for it. I don't care. And then, because it's a lot of money, I also asked for specific batch numbers that I grabbed off of the where'smybatch.com website that are correlated to high.
Oh, that's interesting. Oh, that would be
high
fantastic.
death rates.
Boy, oh
and then
boy.
I asked for control batches as well that I found that did not have any adverse events associated to them. And then I also asked for all of the above information for any special batches they held back for the employees for Pfizer in the US.
Wow, good for you. That is going to yield something. I don't know what, but there's going to be some interesting stuff there. Christy, you're doing God's work.
Thanks. Yeah, and I'm in. Like, I think I messaged you that I'm also consulting with Siri and their firm to help them with their existing litigations because I know so much of this stuff.
Well, so Christy is a out of the biotech world, and she particularly works with the nanoparticles and the proteins and the mRNAs, and she has a lot of experience in data. Sort of, to her, all this stuff is very routine, as I think you've expressed, Christy. And yet we can't even get the routine data to figure out what's going on here. And the extent that people have, now correct me if I'm wrong, but it has been addressed once publicly. And when they addressed it, they said it enhanced the immune response, and yet they had no data to back that up, right?
If you're talking about the lipid nanoparticle.
No, I'm really talking about the scatter on protein fragments.
Right. That they said if it was a fragment that was from the EMA, that it would result in an antibody response, but they didn't cover everything else that can happen with a fragment, and they kind of brushed it off. Like you can have interactions and
and nor did they have data. No, they actually said that it's a broader immune response, implying that it's a better immune response, and they have no research to suggest that. It's insane, but that was just rhetoric. But anyway, Christy, I'm going to put you back in. Thank you so much. Good luck.
Hey, thank you. Thanks, Dr. Drew.
You bet. All right. See Benji Bronk in there. At least you were in there. I don't know if you are still there, my friend. You can come on up if you want. Okay. Got lots of people requesting in here, so hang with me here, guys. Okay, Darren. Here you go. Hi, Darren. What's going on? Darren Aquino. There you are.
Dr. Drew.
Hey, sir.
Dr. Drew. I grew up with rheumatic fever. I had polio. The reason I'm getting to this is I had COVID twice. I had the first one real bad where it affected my respiratory in March. And with all the stress of campaigning, as you can see, I was a candidate. Now, I just had a test. They did the angiogram. They found 2 blockages and the leaks from the rheumatic fever in all the 3 valves.
Right.
Now they're saying I need major heart surgery.
Right.
And I'm thinking, why can't they clear the blockage? Because what I've been experiencing that made me go was a shortness of breath.
Yeah, Darren, there's a couple things. So you have to have your valves replaced, right? So they're going to be in there repairing the valves anyway. And there's various technical ways to go, depending on which valves we're talking about and whether they, what kind of valve replacement and whether they do it surgically or otherwise. But how old are you?
62.
Yeah, I mean, there are various ways of approaching it, but I'm sure they'll want to do it open because you said there are more than one valve involved.
There's a 75% blockage and a 50%, but the 3 major valves, the mitral, the aorta, and the other one had the leaks.
Yeah.
But everybody says with the leaks, that's 20 years.
It
They gave
depends.
me this medicine
Again,
to slow the blood
No, I
down.
understand. No, it decreases the pressure the heart pushes against, so the leaking backwards is less, but
Right.
it depends how much leakage. So, and then if you have coronary artery disease on top of that, which is the blood supply to the muscle, now this starts to get kind of serious. This is sort of an extraordinary setting for coronary disease. And my bet is it's what's called proximal disease. You have disease way upstream where if something happens, it will really kill off a bunch of heart. And so there's certain proximal lesions that have to be dealt, well, don't have to be dealt with surgically, but often are recommended for surgery. And with the valves, I think you're sort of in this, I don't see how you get away from surgery. I just don't see how you
The next part is this. What about, now I'm concerned about these blood thinners. People said you can get this cow valve, the pig valve, but a mechanical valve is not good because that would be a problem down the line.
Right.
I'm a little afraid.
Yeah, I get it. I understand. I understand, my friend. This is major surgery. I will tell you in good hands, the outcomes are usually excellent. The blood thinners are, unless you're an acrobat, it's not going to be that big a deal. It depends on which blood thinners they pick. But, for some of them, you have to get adjusted regularly and watched. And I would say most of my patients are on blood thinners these days. So it's very, very common to need blood thinners. So, and again, there's an interesting sort of, Steve Kirsch might want to jump on this. The fact that I have so many patients on blood thinners, I wonder if that changed the risk profile of the vaccine to the patients I'm seeing. Maybe that made them less prone to things like stroke and whatnot. Let's get Theodora up here. Theodora. Oh my goodness, I have lots of requests here. I'm going to have to get to it.
Hello.
Hi, Theodora. What's going on?
Yes, hi. I have two quick questions. One is I debate folks a lot who still recommend the COVID-19 vaccine for children in the schools here in New York State. It's still a very aggressive policy, and unfortunately, we still have a bill just came to New York legislature for recommending, mandating basically that in the schools. How do you debate those folks? And the second question was any relationship between someone who's had the Pfizer, both vaccines, and then a booster and has cancer. Thank you so much.
All right, thanks. So there is concern about, it's not so much causing cancer, but whether or not it's affecting the immune system in such a way that the surveillance of cancer is altered and cancer can blossom more. So there's a theory, I've seen no good evidence to substantiate this, but people are throwing around the idea that somehow cancer is progressing more rapidly because of the vaccines. I don't know. Certainly in the all-cause mortality group, we're seeing a lot of cancers. I don't know. I don't know if it's from the vaccine. I don't know if it's from COVID. I don't know. There is some good evidence that COVID also, for sure, does something like that. So I don't know. That's something that has to be kind of sorted out. Again, a question. It's got to be answered. As far as the kids, I just don't get it. I just don't understand. The risk to kids is so remote. What I think, I keep worrying that I'm missing the risk tolerance in pediatric populations. So in elder populations, maybe risk is a little more tolerated or something. I'm not sure. The fact that there's such aggressive policy around kids and mandates, I just don't understand it. We don't have the data. I would say at the moment, follow Vinay Prasad, Vinay Prasad. He has got lots and lots of data up on his Twitter feed about, let's see, somebody tell me what Vinay's Twitter handle is. You can maybe put it up.
I'm looking it up.
He's been on the show a number of times. He's got a lot of data up, a lot of tweets up about vaccinating kids and college kids and concerns about that. So you can use his data. And if I were really worried about this, I would think about getting an attorney. And I'm certain there are other parents out there that are similarly concerned doing the same thing. I just am not aware of it. So it's V Prasad, MD, MPH, right? Am I getting that right?
Yes, that's
Prasad,
correct.
Prasad, MD, MPH. So go do follow him. Go look at his threads. It's all in there. He's a brilliant physician, brilliant reader of medical literature, and able to sort out so much of the stuff that is so confusing. Okay, so here we go, everybody. Benji, you sure you want to come up here? I don't know. I'm sure I'm hard to figure out who to bring up at this point. There's a bunch of people here. David, what's going on? I think David.
Hey, Dr. Drew, thanks for bringing me up.
You
So
bet.
just quick background on myself, military officer. So these opinions are my own, do not represent the DoD or the United States Air Force. Hey, the one thing I want to bring up, I know you talk about mandates often. And I don't know if you saw on January 11th, they renewed the emergency declaration for COVID. And now there's a legal reason they did that. And this is I know when people hear this for the first time, it's hard to believe, but we still don't have any licensed vaccines in the United States.
Right.
What they did was you are tracking. Yeah. So because we don't have licensed vaccines, the mandates, all of them essentially were unlawful, executive overreach. And we're actually suing the Department of Defense. Well, we're making some headway, and just wanted to put that stuff on your radar. And when we're having the medical debate, like I said, I think it's important also to have the legal conversation everything we've done.
I think a lot of this is going to get sorted out in the courts. Are you using? Now I'm blanking on her name. The physician from the Air Force who was so gravely concerned about her pilots. We interviewed
Dr. Teresa.
Yes.
Yeah.
Yes. Teresa Long. Yeah.
Teresa Long.
Yeah.
I'm not sure. I think she might be giving expert witness.
She's very good.
McCullough might be. I think Dr. Malone is giving us expert witness. Who's that? Who? Jay
Bhattacharya.
Yes, Jay Bhattacharya.
Yeah. Bhattacharya is going to be one of the poster children of the excesses of this pandemic. How he was treated was just reprehensible, just unbelievable.
Right. I mean, what we're seeing is Anthrax 2.0. I don't know how familiar you are with that legislation as well. When they mandated, that was the first EUA that they mandated illegally, and the attorney actually that fought that mandate is the attorney fighting this case, Dale Saran. Amazing history, Marine helicopter pilot turned JAG officer. His case, back then when they took on these anthrax guys, everybody thought they were going to lose. They took the case all the way up to the Supreme Court, and that's when when Congress put into law, like, hey, you can't mandate unlicensed emergency use authorizations.
Now there's fear. So there's fear. I've heard these arguments. I'm not an advocate for these arguments. That the reason any of the early treatments that have been advocated were so silenced was that the only way to have an emergency use authorization is if there are no other effective treatments, number one. And then
Dr. Drew, it's so refreshing for you to say these things, because we've been making these points.
Okay.
No one's
And then number
out.
two, why the push to get the vaccine on the children's vaccine schedule of routine vaccinations? Well, the reason for that, some are arguing, is once it gets put on that schedule, it now is permanently devoid of liability. At that point,
Correct.
Liability is expunged from then on. And it's concerning. I mean, it's an argument you hear and you go, whoa. Because if I really understood why the vaccines were so clearly beneficial to kids at no risk, I would be very skeptical of those arguments. But because they're being pushed so aggressively with no clear benefit, I mean, COVID is so rarely problematic for kids. I don't know. I don't get it. Or maybe
even
go ahead.
Even in the military too, the only reason the Secretary of Defense stopped the mandate is because Congress had to force him to stop. And so what we're seeing, by the way, is that some of the folks that were scheduled to be separated, to go into the separation hearings, they haven't canceled them. They've postponed them. So this is what I'm trying to put on people's radars: public policy versus shadow policy. When Secretary of Defense says, he respects religious freedoms, meanwhile, the only folks in the military that were getting their religious accommodations approved were guys that were already separating. Their careers were over. They already had one foot out the door. Just for public sake to say, hey, we're approving them. But it's just been a wild mess.
It's a wild mess. Go ahead.
You too, like military age guys, we're not a threat for COVID, yet we've vaccinated 96 to 98%. So if it's as dangerous as we think it is, that's a ticking time bomb waiting to happen.
Didn't I see something? There's so much noise out there that a couple airlines are requiring pilots to have EKGs because of the concerns about the vaccine.
Yeah, Steve Kirsch just posted a Substack about it, checking with the FAA. Suddenly, they're adding EKGs to the medical screenings. So let me tell you something interesting about that too. Per the FAA regulations, pilots, because of our health and everything, the drug has to be any kind of treatment, any kind of drug has to be licensed on the market for a whole year before you can mandate its use. But I mean, we just lost our mind in this pandemic. Like you mentioned, the whole fear thing.
Yeah.
And the FAA said, oh yeah, you guys are grounded for 2 days. If you get injected, you'll be fine. And then the Air Force just followed suit.
It's very weird. This is not normal. Something is not going right. But thank you, David. Good luck with that. Keep us posted on how it goes.
Thank you. Thanks for having me.
It's just so wild. All right, I'm going to keep going. So much of this feels like nothing I've ever experienced before. That's all. Just hard to. All right, I'll get Sylvia up here, see what she's interested in talking about. Appreciate these calls, everybody. Let's see what we have some tweets up there too. I'm not sure what Lynn is saying up there. Sylvia, what's going on? Hi there.
Hi, Dr. Drew. Oh, yay. Okay, real quick. I know you're rushing through this. I've been wanting to ask you this for 2 weeks. Okay.
Good.
So everyone is like, with the kids at first, you know how they're changing the story 50,000 times.
Mm-hmm.
Oh, it was the lockdown. That's why all the kids are sick now. RSV, flu, all this stuff. But now I'm reading that they're finding out more and more, some scientists, I just want to hear your input on this, that maybe COVID is creating, whether it's the vax or you get it, our immunity to go down, and the kids not being vaxxed or getting COVID over and over and over, that it's taken a toll on their immunity. I've read it, so I know you probably.
No, that is a theory. That is a theory, and so the question is, I'm prepared to accept that, but no one has addressed whether or not the vaccine adds to that, or the vaccine is equivalent to that, or worse than that, and that's the problem. What's the risk reward?
Yeah.
I do have concerns that COVID does all kinds of things to our system. It does. I mean, to say that it doesn't is false. It does, and whether or not repeated episodes are going to have some as yet undocumented effect on our immune system, I guess it's possible. It doesn't look like that's really happening. It really doesn't. In fact, some of the data that's coming out looks more like the vaccine pushes things down a little bit more than natural immunity does repeatedly. I know myself, I've noticed that when I'm around COVID, I don't get it. My immune system seems to be doing very well, and I've got a shitty immune system when it comes to viruses, and it seems like I'm doing pretty well these days. And I had, COVID a couple of times, bad one time, and I was vaccinated once, and maybe that extra vaccine really helped me. I'm not sure. I wouldn't get booster because I had a terrible reaction to the vaccine, as I've discussed before.
But I know that kids are like, they get sick. I get it. I know that's your input on it. I totally respect that. But don't you think this is crazy how sick these kids are getting? Like, I have a friend that is a teacher assistant. She's like, Sylvia, there's days we go to school, nobody's there. Like, it's wiped out the complete class.
Definitely viruses are up. It may have nothing to do with COVID and more to do that we haven't been more than we're not challenging our immune system. Or it may be that everybody's freaking panicking every time a kid gets a sore throat and keeping them home in case it's COVID, right? I mean, there's a lot of unanswered questions, but I share your concern. I really do. And the fact that I can't give you a real clear answer that I feel is a clear answer, that's scandalous to me. It's really not good. All right. So Corey, let's come up. I'll get Corey a chance to come up. You guys, when you have scary pictures on your profile, it makes me move a little bit towards somebody who looks less scary to me, I must tell you. So I'm not sure scary profile pictures are really a good strategy. But Corey, what's up? I have to be honest. That's the way because I have 30 people to choose from, and somebody with fire coming out of their eyes, that worries me more than Corey. Corey, what's up?
Yeah, on the 13th, I went to the ER for chest pains, and they did a EKG, and that came back good. And then they did a troponin level. The first reading was 15, and then the second reading was 11. And they prescribed sucralfate, 1 gram per 10 ml suspension.
Yep.
Of course, I also have a history of acid reflux.
Right. What is the question? I get what they're doing. What's the question?
Well, on the sucralfate, it says take for chest pains or stomach pain.
Yeah, they're telling you you don't have a heart problem, you have an esophagus problem. That's their opinion.
Okay.
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 All right. Sorry about that, but the troponins are concerning in this day of mild troponin elevation after vaccine, and it implying maybe some myocarditis. But in and of itself, in an assessment with a normal EKG and other parameters negative, I can't. They're telling you not to worry about. Now you should go see your doctor for sure and get a definitive. Get up on a treadmill and get definitive workup for sure. So don't neglect that. You might be being just sort of. It's sort of. ER's move is to make sure you not have an imminent disaster and then refer you back to your doctor. There still can be trouble. Somebody had something interesting here I wanted to get to. I'm sorry. Okay. Well, you guys are tiring me out a bit here. Let's see what I've got. It's jumping around a bit. All right, I'm going to tell. Oh no, I know it was. I'm sorry. Hold on. Winston, what's going on, Winston? I think the name is Winston. Yeah, Winston. Hey there.
Hey, what's happening, Dr. Drew? Just wanted to ask a question of you and kind of get your, over the past, I'd say really 8 months, I've watched you kind of deal with these red pills in a suppository manner. It's been kind of a rough, tough sledding for you.
It's not. It's no different than any other. It is, but it's the medical. Like I've been saying, hubris is the enemy. We should not be certain of anything. We should be ready to adjust based on currently available knowledge. The only what's come into focus for me is these areas where we need some questions answered and they're not being asked, and that's deeply, deeply troubling.
I mean, it's the further we get from this thing, we're going to get that kind of rational hindsight, and of course, that's part of the human condition and X, Y, and Z. But it just seems honestly, from a management standpoint, it's just a complete farce how it's been done by any semblance of government, public health, anything. We've literally done the wrong thing.
I agree. I think when the House Judiciary Committee digs into this, there's going to be tremendous revelation. Tremendous.
And it seems like I don't want to say idealistic or whatnot. I think maybe faith, you have more faith than I do. And I'm just,
I do.
I don't want to be the seedy cynic.
And you could say I'm naive too. Right. And that's a reasonable complaint. You got to understand, I'm looking at it from the standpoint of care of patients. Right. So I have a particular perspective on this where I'm want to be making, I think it's extraordinary that we were able to come up with these treatments, whatever you want to call them. Jabs,
bingo.
I like it. Whatever you want to call them. And my job is to figure out how to best use them to help people. In the meantime, there are all these crazy mandates and excessive recommendations that are confusing to me. And maybe this is where I might look naive. So rather than going, well, that just, I'm not taking a position and maybe I should. So that's a legit, I should be saying, hey, based on everything I'm seeing, what the F are we doing here? This is crazy.
That's exactly right.
Instead, I'm saying, I'm trying to keep my verisimilitude intact, or whatever word you want to call it. There's my that Sir William also used to call it. There's a word for it, and try to, rather than take a super strong position, just prepare for the data as it comes in, because it is loud and confusing. I got to tell you, it's not as though I can say anything with great clarity. It just looks like something is really wrong. And
well, you're a doctor too, so it would make sense to you. I'm a moron, so it's not going to make sense to me. But you're going to quote Sir William, I'll quote an old South Park episode where we don't take kindly, and somebody keeps going, "Now Skeeter, he ain't hurting anybody." You seem like that kind of now Skeeter, you're you're really going
I'm trying
hard for them. Like
I'm trying. I'm trying to thread the needle. I'm trying to thread the needle. And look,
it's a delicate art.
There's horrible stuff coming through on the Twitter files constantly. And let me tell you, the opioid epidemic was a catastrophe. And I believe this is going to be the same in the rearview mirror. But are there going to be tons of smoking guns? I bet not. I bet the smoking guns are going to be very specific. And these people have had far-reaching effect, reverberating on everybody else, and have done untoward harm because of it.
I don't even think the opiate comparison is a fair one, Doc. And for the simple reason, we didn't force opiates onto 5-year-olds. My childhood would have been a lot better if we did.
Yeah. No. You're right. It's that's fair enough. And it's on a larger scale. That's for sure. Much larger scale. Go ahead.
My question for you would be this. I mean, do you have like a mental demarc point? Because I've watched and it's been getting more and more damning as the weeks have come by.
Yeah.
So I would ask you, like, I mean, again, like the thing with Scott Gottlieb, everybody knew that guy was a shitbag from the jump. I mean, former FDA Pfizer board member. Oh, weird.
Yeah.
But do you have a mental demarc point where you're like, okay, this is clearly too far?
It is. What do you mean? It is clearly too far. Like somebody,
is there data that could come out, some new revelation come to light, to where you would be like, okay, that's it. My darkest fears are confirmed. Because I tend to get the feeling.
Yes. So here's what I need to know: are there excess deaths, and is there a sudden death syndrome? Is that happening? Okay. Yes or no? Is that happening? Because every time I think I see yes, I see data that says no. And I told you earlier, about an hour ago, I was talking about my experience in digging through the medical literature and being unable to get the answer on a simple question, because the medical literature is adulterated right now. I don't know why. I don't know exactly how it's happening, but something is wrong. So answer that question. Is there a sudden death syndrome? Is there excess all-cause mortality? Yes or no? If it is it COVID, or is it the vaccine, or is it both? Yeah, which and why, and what's the mechanism? Prepared to accept both, but if it is the vaccine at all, show me the risk-reward analysis. So those are the three things I need. Is this thing happening that I think is happening? Is it caused by COVID or vaccine? And then whatever that answer, give me the risk-reward analysis on the vaccine. That's it. Very simple. But,
right. I mean, it's a legitimate bar. It's just, to me, again, like I read these white papers and I read all this peer-reviewed stuff, and to me, it looks one way. But again, with no proper medical training, I genuinely don't know what I'm looking at.
But I got to tell you something. I'm sympathetic to what you're saying, because the literature is all over the place.
It's so obfuscated, and it seems deliberate.
It's something. I don't know. I don't know what's going on. I've never seen anything. I rely on the medical literature. I've relied on it my entire career. And when I go in and try to answer a simple question and I can't tell if it's way on one end or way on the other, that is a problem. There's something wrong. And so I'm worried about that. I'm very worried about that. And so that's another thing that needs to be answered, by the way. Why is that happening? And what is it? What am I seeing?
I think it's because, I mean, this is, again, I consider you to be one of the top doctors in the game. Your birth of knowledge is insane to me, but I think as a society, we tend to put doctors on a pedestal.
Sure.
And I think a lot of them are very pedestrian people, to be perfectly honest. I've not had a real, like, knock my socks up interaction with any GP.
You know what it is? It's that a lot of them they're all smart. They're all well-trained. Sure. But a lot of them are not thinking and just going through a road. Because I used to train physicians, and I used to have to scream at them about that a lot. Like, think it through, have a backup plan, give me your reasoning. And sometimes they just couldn't. And they just did it because it was their pride. It was rote. It was something they'd done a million times.
Just automatons.
Yeah, and that's troubling. And I think this world of algorithms and, hospital employees and all this stuff and clinical pathways are making it a lot worse. Winston, I'm putting you back in. Thank you so much, my friend.
I appreciate you, Drew.
Okay. So, it brings up the issue of the new variant, XB.1.5.1, isn't it? XXB. I don't know what to make of that. There are going to be many more variants as we go along here. That one seems to be not that big a deal. It's certainly more infectious than the rest. Catherine, come on up here. And really highly infectious variants can also help us with our immunity, provided that it's not causing adverse effect. It's worth the immunity for whatever it is the COVID is doing to us on a long-term basis. And my sense is that natural immunity is I'm going to take an opinion here based on Winston's coaching, that natural immunity is better and safer. I'm going to say that. At least better, if not safer. Catherine, what's up?
Hi, Dr. Drew. Thanks for taking the question. I just have a little bit of a curiosity question. When I've heard this before, I read this in RFK's book, when they get the vaccine on the childhood schedule, that they are permanently indemnified.
Correct.
Why is that? Is it more rigorous testing? What is
no,
it that?
I don't know. It's a law. Obviously, there's some legislation that permitted that. Why they decided that was a smart thing? I mean, I don't know. I guess it's because it must be because if you're going to vaccinate, if you're going to give everybody something, there's going to be massive liability. And unless you have a way to protect from that liability, no one's going to produce or create those things that are going to be created. Because there's always going to be something. Every time you walk in a doctor's office, you take a risk. And vaccines are not without risk. And if you're doing it to hundreds of millions of people, there are going to be at least hundreds of thousands of problems, if not, let's say tens of thousands, that could be extremely costly.
So it has nothing to do with, for children, there is a requirement to do more rigorous testing or many more years on safety.
Well,
profile?
there is more rigorous testing required for vaccines. Usually, prior to the present moment, vaccines take years and years to get to the market. Any adverse signals are jumped on. And yes, they usually are extremely well studied, which is why people are so quick to dismiss concerns about vaccines. Because look, from the standpoint of the history of medicine, they've done a ton. I mean, they've really gotten people through childhood where people used to routinely die in childhood. And it is, been carefully tested, and millions and hundreds of millions of people have taken these things. Doesn't mean it's without problem. And the extent to which those problems are real and what they are, and how do you give somebody informed consent? I thank God I don't have to do that because I'm not a pediatrician. Catherine, I got to throw you back in here. Thank you so much. Thank you, everybody. Go ahead,
Drew.
Caleb.
I actually have a question that might kind of follow on to that as well. So I was prescribed a medication, and I was reading the sheet that comes along with it, and it says directly in there that the mechanism of action is unknown. So how are these drugs and medications getting approved when they don't even know how they work? What are the steps behind that?
Sometimes they have a suspicion what the mechanism of action is, or have evidence of certain things going on, but they may not. Look, we don't know for sure how antidepressants work. The whole story about the serotonin reuptake may or may not be the story. As you know, with the fluvoxamine, there's a sigma-1 receptor, and maybe fluvoxamine mostly works through the sigma-1 receptor and has anti-inflammatory effects on the brain, and that's the main mechanism. We don't know. And so when you get to the newer stuff, what was it? It's like one of these.
It was
for the Crohn's
it was a
kind of
cream. Yeah, I think it was for something for psoriasis, I think. And I was just reading the paper through it, and that's when I went and dug through. And apparently, there's a lot of these that they don't know the mechanism of action on, like antidepressants and lithium and all this.
But there's lithium, and there's theories about it, there's ideas about it, there's evidence, but it's not for sure. We know exactly what the mechanism of action is on various things. But topical stuff, sometimes it's things that were being used before the FDA existed, and they just sort of get grandfathered in. Right. And that's a lot of what happens, and I bet that's what happened in this case. You have to come up with a plausible mechanism of action in pretty much everything you use.
Right. It was just shocking to me when I read that, and I was like, wow, they've put, probably hundreds of millions, maybe billions into marketing this cream, and they don't even know how it works.
Is it a new cream or an old cream? But maybe it's an old thing.
It might have been an older thing. It might have been a generic name.
Yeah, the old things just kind of even like Synthroid never went through the FDA, right?
Really?
So there was concerns when, I mean, that
the thyroid
things
medication?
like that. So, but levothyroxine, I believe, has been through it. So, so people sort of switched over to levothyroxine. But all right, so I got to wrap up. We are really had some great calls, some great conversation. I appreciate everyone that stepped up. Caleb, any last questions?
No, that was my last question. I was just curious.
Okay. Anything I should look at on the Rumble rants or?
No, we had
the National Childhood Vaccine Injury Act of 1986 gave Big Pharma immunity from vaccine injury. It was a 1986 act, according to Imagine That. So look that up. What was that, Caleb? You were going to say something?
No, we have a lot of very great guests coming up, especially tomorrow. I'm really excited for Dr. Stephen Hatfill. If for people who aren't familiar, go go Google him for one thing. You have to hear his crazy story tomorrow. He's going to talk about it, I'm sure. But he was falsely accused right after the 9/11 attacks of being a guy mailing anthrax to people because he was a bioweapon specialist who had access to similar types or strains of anthrax that were being mailed out to people. He ended up winning, I think it was like a $5.8 million lawsuit against the Department of Justice because they tarnished his whole image and his career. And then he kind of went under, not very much seen for a bit of time. And now he's popping back up again as a bioweapons expert. I'm very interested to hear what he has to say tomorrow with Dr. Victory.
Excellent. And back to your point about mechanism of action, I was just thinking that doctors are free to use medications however they wish. They're just because something's labeled in a certain way, that's what the drug maker needs to qualify for to bring the drug to market. What we do in the practice of medicine with the drug is strictly up to us. And sometimes we don't necessarily know the mechanisms of action of what we are doing there. So I always try to understand the mechanism of action, that's for sure. But I'm certain that there have been times where the mechanism wasn't that clear. And yet the clinical efficacy was. So that's why we do it. All right. Thank you so much for being here tomorrow. As you said, Dr. Hatfield, do you want to throw up any other upcoming dates? Thursday, I'd like to do a show on Thursday if we can. Probably be more calls. Dr. Hatfield, Dr. Ryan Cole on February 1st. We were going to get Dr. Rose next week, who had been fantastic. I'm very interested in her stuff. But that is sort of moving. It's a moving target right now. And hey, Caleb, that show, by the way, we may need to move to like 4 o'clock. I'm sorry to tell you.
Tomorrow's?
The 25th. The
25th. Oh yeah, and also we actually aren't doing a show on Thursday the 19th this week. We aren't doing one this Thursday. The next one's
sure
tomorrow.
We're not? You don't want to do one, or we're not doing one?
I don't know if I'm going to be here for it. I'll have to ask Camden to be.
All right. All right. Fair enough. If you're not here, we won't do it. So we will be here tomorrow with Dr. Victory, as we always are. And we will see you then at 3 o'clock. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.
I've always heard people being constipated, but I've never been constipated as far as I know.
Remember when you had the diverticular abscess?
Mm-hmm.
Didn't you have constipation then? Or at least in the operation afterwards?
No, I shot quite a lot during that. But my question is, because recently I had an episode and I wasn't sure if I was constipated or just I had a shit that was too big to shit out.
You can. Yes, things can get dry and impacted up there, and it can be hard to get it through. Yep. That's constipation.
That is constipation?
That's a version of constipation. There's different manifestations.
Then I was constipated for the first time 2 weeks.
Maybe that's what he was
you
doing.
You want to experience that?
See?